Hello everyone, in this video we will talk about all the drugs which act on autonomic nervous system. The drugs acting on autonomic nervous system are divided into four groups. The drugs which stimulate the action of parasympathetic nervous system are called parasympathomimetics. While some drugs oppose the action of parasympathetic nervous system, these are called parasympatholytics. On the other hand, some drugs stimulate the action of sympathetic nervous system. These are called sympathomimetics, while some drugs oppose the action of sympathetic nervous system. These are called adrenergic or sympatholytics. Starting from sympathomimetics. The sympathomimetics are divided into three groups on the basis of their mechanism of action. Some are direct acting, some are indirect acting, and some have both action, direct and indirect. The drugs which have both actions, direct and indirect, include ephedrine. The drugs which have only indirect action are further divided into two groups. Once again, this division is on the basis of their mechanism of action. Some indirect acting sympathomimetic drugs releases neurotransmitters from sympathetic nerve ending. These include amphetamine, methamphetamine, theramine. Some indirect sympathomimetic drugs inhibit reuptake transporters. These include cocaine and tricyclic antidepressant. Coming to the last and important group of sympathomimetic, which is direct acting. The direct acting are further divided into three groups on the basis of their affinity for the receptors. Some have greater affinity for alpha receptors, some have relatively more affinity for beta receptors, and some act on both alpha and beta receptor. So we have alpha and beta agonist, and beta agonist. Coming to the drugs which have both alpha and beta sympathomimetic action, these include epinephrine, which stimulate both alpha and beta receptors. We can say epinephrine stimulate alpha and beta receptors. Norepinephrine is another drug which act on alpha and beta receptor, but it doesn't act on beta 2 receptor. Dopamine also belong to alpha and beta agonist, but it also does, but it doesn't act on beta 2 receptor. So dopamine binds to D1, alpha, and beta. Coming to the alpha agonist, these include non-selective alpha 1 agonist, alpha 2 agonist. Non-selective alpha agonist means they can bind to alpha 1 and alpha 2 receptor, while alpha agonists have selective affinity for alpha 1 receptors and alpha 2 have selective affinity for alpha 2 receptors. Non-selective alpha agonists include oxymetazoline, while alpha 1 agonists include phenylephrine, tetrahydrozoline, and midodrine. Alpha 2 agonists include clonidine, methyl-dopa, apraclonidine, brimonidine. Coming to the last group of direct acting sympathomimetics. These are beta agonists. Beta agonists are also divided into three groups. Non-selective beta agonists which act on both beta 1 and beta 2 receptor. Beta 1 agonist and beta 2 agonist. Non-selective beta agonists include isoproterenol, while beta 1 agonists include dobutamine. Beta 2 agonists are further divided into two groups on the basis of their duration of action, and these beta 2 agonists are important in asthma. Beta 2 agonists include short-acting beta 2 agonist and long-acting beta 2 agonist. Short-acting beta agonists include albuterol, metoprolol, terbutaline, deutetraedrine, while long-acting include salmeterol, formoterol, indacaterol, vilanterol, oladeterol. This was all about sympathomimetics. Coming to the sympatholytics, also called adrenergic blockers. Adrenergic blockers are basically divided into three classes. alpha blockers, beta blockers, and alpha and beta combined blockers. Alpha and beta combined blockers include labetalol and carvedilol, or also called servidolol. Alpha blockers are further divided into three groups on the basis of their affinity for respective receptors. Some are non-selective, meaning they can block both alpha 1 and alpha 2, while some are beta blockers, which are also divided into non-selective beta 1, beta 2. Coming to the alpha blockers, non-selective alpha blockers include phentolamine, phenoxybenzamine. Alpha 1 blocker include prazosin, doxazosin, terazosin, silodosin, and tamsudosin. Alpha 2 blocker include euhambine and riobolsin. Coming to the beta blockers, which are three: non-selective, beta 1 blocker, and beta 2 blocker. Beta 2 blocker include butoxamine, while beta 1 blocker include esbitalol, nebilol, esmolol, metoprolol, atenolol, bisoprolol. Non-selective beta blocker include propranolol, betoxolol, nodenolol, pindolol, timolol, and sotalol. This was all about adrenergic blocker. Coming to the parasympathetic nervous system. Parasympathetic nervous system scheme is same as that for sympathetic nervous system, that there are some drugs which stimulate the action of parasympathetic nervous system while some drugs oppose the action of parasympathetic nervous system. These are parasympathomimetics and parasympatholytics. Coming to the parasympathomimetics, the parasympathomimetics are divided into two classes: direct acting and indirect acting. Direct acting means that these parasympathomimetic drugs act on parasympathetic receptors, while indirect doesn't act on parasympathetic receptors but act on metabolizing enzyme which is acetylcholine esterase inhibitor. Direct acting parasympathomimetics are further divided into three groups. Some act on both nicotinic and muscarinic receptor. Some act on muscarinic receptor only. Some act on nicotinic receptor only. The drugs which stimulate both muscarinic and nicotinic receptors are acetylcholine and carbachol. The drugs which stimulate only muscarinic receptors include bithanacol, methacholine, pilocarpine, muscarine, lobeline. The drugs which stimulate only nicotinic receptor are nicotine, varenicline, succinylcholine, while the drugs which are under indirect parasympathomimetic group are also called acetylcholine esterase inhibitor. They are further divided into three groups: alcohols, carbamates, organophosphates. Alcohols have very short half-life, while carbamate have intermediate duration and organophosphate has very long duration of action. Alcohols include aldrophonium, which is used in the differentiation of cholinergic crisis from myasthenic crisis. Carbamate group include neostigmine, physostigmine, pyridostigmine, and benonium, while organophosphate include parathione, malathione, matrophenate, ecothiopate, sanitubin. Last but not least, the chapter, or you can say group of autonomic nervous system drugs include parasympatholytics. The parasympatholytics are further divided into two groups on the basis of their mechanism of action. Some act on muscarinic or nicotinic receptor, while some act on acetylcholinesterase enzyme. The acetylcholine esterase regenerators are also called oximes, which include pralidoxime, obidoxime, while anticholinergic drugs are further divided into two groups: antimuscarinic, antinicotinic. Antimuscarinic include the prototype drug which is atropine, while the drugs acting on CNS include scopolamine, benztropine, piperidine, trihexyphenidyl. Scopolamine is anti-motion sickness drug, while benztropine is used in Parkinson. I drugs means drugs acting on eye include atropine, homatropine, cyclopentolate, and tropicamate. Drugs acting on bronchi include ipratropium, tiotropium, aclidinium. Aclidinium Tiotropium are long-acting muscarinic antagonist, while ipratropium is short-acting muscarinic antagonist, which are used in asthma. The drugs acting on GIT are further divided into two groups, non-selective and M1 selective. Non-selective include dicycloamine, glycopyrrolate, hyoscyamine, while M1 selective drugs include perenzoepine, tilenzoepine, while the drugs acting on bladder include non-selective muscarinic blocker or M3 selective blocker. Non-selective bladder drugs include oxybutynin, trospium, while M3 selective drugs include tolterodine, fosterodine, propivarin, darifenacin, solifenacin. Last group of this video, which is anti-nicotinic drugs. The anti-nicotinic drugs are further divided into two groups because nicotinic receptors are present on both ganglia and neuromuscular junction. Drugs acting on ganglia include hexamethonium, mecamylamine, trimethophan, while neuromuscular junction blocker drugs are further divided into two groups, depolarizing, non-depolarizing. Depolarizing include succinylcholine, while non-depolarizing include rapid-acting, moderate, and long-acting neuromuscular junction blocker. Rapid-acting include atracurium, cisatracurium, while moderate-acting include mivacurium, vicronium. Long-acting include doxacurium, pancuronium, and tubaculin. This was all about the drugs acting on autonomic nervous system. Hope you have liked this video. So support this channel by subscribing the red button and hit the bell icon for more notifications. So stay tuned. Thanks.